welcome everyone to our September. I know what month it is, September webinar. Um, for those of y'all who are new to our LNEC webinars, I'm Megan Lippy. I'm one of the co-investigators for LNEC, the End of Life Nursing Education Consortium. I'm an associate professor at UT Health in San Antonio. And I'm joined by my colleague, Dr. Andrew Davis at University of Portland, who's an associate professor there. Together, she and I support faculty at schools of nursing with their palliative care educational initiatives. This webinar series we've been doing for a couple of years now. We do monthly webinars in the fall and spring semesters, just as a way to provide resources for faculty engaged in advancing palliative care in their schools of nursing. So we're thrilled to have y'all. One thing we'd like to do in these webinars, if you'll just drop in the chat where you're joining us from, and also if this is your first webinar or if you've been to a webinar before, we like to get a sense for who's with us.
I see a lot of new names, actually.
I know, it's very exciting.
First time.
So one of the things that we like to do, especially when we kick off our series in a given semester, is we just like to start with a brief orientation to a little bit about LNEC and the things we have to support faculty with schools of nursing. And then we'll dive into the really good stuff, which is our new resources we have for interactive teaching strategies. So with that, so we're going to talk about our faculty guides, and then we do want to hold a little time for us as a collective group to brainstorm ways that you might consider using this guide or other teaching strategies in your palliative care educational initiatives. We do like to acknowledge that both Dr. Davis and I, our work with LNEC is funded by the Cambia Health Foundation, and LNEC has been existing since 2000 through a partnership with AACN. So we always like to acknowledge AACN support as well. Oops. So for those of you who might be new to LNEC, again,
Can everyone see the slides?
Can y'all see the slides?
Yes.
Yes. Okay.
Okay, thank you.
So the history, so LNEC started in 2000, which in 2025, drum roll, big 25th anniversary things are coming down the pipe. So be on the lookout for all those exciting things. LNEC started with one curriculum, and it was LNEC Core. The first course was held in 2001. And then, 17 years later, there was a recognized need for resources to support schools of nursing, and that launched with LNEC Undergraduate. Dr. Davis and I have recently done updates of the undergraduate curriculum, which rolled out in September 23. So if you've been using the curriculum for a while and you haven't looked at the modules, those you might want to check them out. They've been updated for about a year or so. And then shortly thereafter, LNEC Graduate was released to support faculty teaching and graduate programs. For those of y'all who might not be familiar with those, each of those curricula are online. They are $29 per student for the whole curriculum. They have access for 12 months to 6 modules that explore all of the facets of palliative care. And we like to think of those as basically better than a textbook, that it's up-to-date information, it's the didactic information, and then what we hope is that faculty in the classrooms are helping students to apply and explore and really get into what does it look like to provide palliative care to patients who are living with serious illness. And that's part of what we're going to talk about today. So many of y'all, I think, are familiar with the essentials. Some of you might not be an AACN school, but if as those of you who are accredited by CCNE, you might be well familiar with this. We're very thrilled about this hospice palliative care sphere. And that's what's really launched us to want to make sure we're providing faculty with as many resources as we can to engage students, to help them learn about hospice, palliative, and supportive care. We have some resources that we want to share. One is competency statements, right? Competency-based education, we have 2 sets of competencies. If you are teaching undergraduate or entry-level students, we have our CARES competency statements. These are 15 statements that we kind of categorize like CUSING competencies. They're sort of these global competencies that schools of nursing can use to guide their curriculum development related to palliative care. GCARES is the graduate version. So for your advanced level students, 12 competency statements for those students. Those are housed on our LNEC faculty corner, and those have all been mapped to the AACN essentials, all the way down to the sub-competencies, as well as the concepts. So check that out. We'll show you what the faculty corner is in just a moment, and where you might find those. Since the launch, our most recent numbers, so LNEC undergraduate is currently has been looked at or used in 1,211 schools. So we're seeing great growth. And LNEC graduate is over 400 schools now. So we're very excited to see this continual growth in the use of these evidence-based curricula. So again, we have a website. It's LNEC Faculty Corner. You can just put that in your search engine, LNEC Faculty Corner. We can also put the link here in the chat in a second. This is where you can find all things related to the work you're doing in schools of nursing around the sphere of hospice palliative supportive care. And so Andrew and I, as I mentioned, we part of our passion is to support schools of nursing and faculty doing this work. So here's our contact information. We have, though, sections dedicated to teaching resources. These are teaching resources in addition to what we're going to talk about today with our faculty guides. All of the webinars we've done have been recorded, this one included. And then there's podcasts, case study sims, publications, and the list actually goes long. I just couldn't screen grab all of it, but we have lots and lots of resources. Most recently, our perinatal palliative care module has been posted on the LNEC corner. So you might want to let your peds or your OB faculty know that module is freely available for faculty to use. And then although today is about teaching strategies, we also want to make sure we share that we have lots of evaluation resources that we try to keep building this section as well. And there's a brand new publication. It's online ahead of print that has come out in Journal of Hospice and Palliative Nursing, where we have a team of faculty who support schools throughout the country. We came together and identified instruments in the literature that are valid and reliable to evaluate learning outcomes in this sphere. So encourage you to check out that publication. You can access the reference on the faculty corner. And we send slides out after the webinar. So if you wanted to see this, we'll send out the slides at the end of the webinar for everyone who's attended today. All right, so that's the kind of quick rundown of our background. And so now I'm going to turn it over to Andra, who's going to get into the exciting things about what are these resources we have for interactive teaching.
Thank you, Megan. I wonder if we could, there's a lot of new folks here. And Pamela just said that the undergraduate students love the modules. That's really great to hear. All the comments are welcome over here in the chat, but it would be interesting to hear how many of you are using the modules, because what we're going to share with you is quite tied to resources that are tied to actually using the modules. So if you want to put that, just a thumbs up or something like that, some sort of way for us to see that you are or aren't using them or not familiar with them. Did you mention, I was busy over here, Megan, doing some stuff with my screen. And did you mention that they can request the modules?
No, but thank you. So two things I see.
Yeah. So, go ahead.
Well, so someone mentioned they joined because they're doing simulations. Please go to the faculty corner, because I think we're up to almost 10 simulations that have now been published for free download to use that have elements of palliative care in there. So if you're a sim person, go check out all the sims that we have, because there's been several that have been recently added as well. But if you want to talk about access, yes.
Some of you are, I can't quite tell from the screen here how many people are using LNEC or not, but if you aren't, you can just make a request yourself. Any faculty at your school that wants to review the modules can make the request at City of Hope. And they'll send you, you just give your particular school email address. And I just got a request, for example, from our sim folks. We have a bunch of new folks teaching in sim this semester. And so we have new people that need access. And I just sent all those email addresses forward to City of Hope, LNEC at cityofhope.org. And then you'll have access, and you can at the same time get access to these resources that we're, thanks Megan, that we're going to show with you a little bit. So the way that this is kind of set up is, she mentioned there are 6 modules, and we have new faculty guides that we're really excited about. We spent quite a bit of time in the last better part of a year putting these together. And it really has, for those of you familiar with other resources that have come along with the modules, we've consolidated, updated those, and added new things to those modules. So with that, we're gonna take you through parts of 2 of the modules in particular. I actually will show you communication as well, but I'm gonna jump into the grief, loss, and bereavement module and show you kind of how the guides are aligned with the actual module. So you should be able to see my screen now. And this was the best way we thought that we could share this with you, is on the right-hand side. That is the interface of the module. And on the left side, I'll show you the faculty guide a little bit. But the most important thing to kind of notice is, can you see my mouse here? On the sidebar over here are the different sections of the module. So this is grief, loss, and bereavement, which is module number 5. And these are the different sections over here of that module. And then as students move through, you can see that this green check means I've actually gone through those pieces, and I haven't finished. Every time I go in, you have to redo it. So I'm going to click over here now on the guide for this module, and they all are set up this way. So each one of them that you get starts with a description, which actually mirrors, it's just exactly the text from the module. And the learning objectives also come from the module. And the preparatory activities are to complete the module. So basically, the students can do this online. Those of you that are not familiar, they're estimated to take each one of them somewhere between an hour and a half, depending on the module. And you could assign that, for example, as homework, reading, whatever. And then really important, and part of the reason, the impetus behind creating these guides is to support you in teaching strategies in the classroom to unpack what's in the modules. So, which is why we sort of lined them up this way. And if you start using these and you want to give us your feedback, we really would like to hear how it is functional for you. So then we have this section on all of them about linking back to the faculty corner, just as a reminder that this isn't the only resource that you have available. So here are the table of contents, and you can see if I hop back over here that I'll scoot it over a tad. I did this earlier and I lost the whole screen, so I'm being very cautious. So overview of loss, grief, and bereavement is the first component, and then it comes down here to the nurse's role in loss, grief, and bereavement, and then the effects on the nurse, which come down a little bit more right here. So the different sections are all capped, but you can see the nurse's role. There's all these different sections in here as well. So what we're going to do is say, you watch it ahead of time, or you at least know that these are the components that they have to complete. And here are the objectives, learning objectives. So what might you use? And, you know, if you have some cool things that you're doing, we want to know about it. So we're going to say it now and we'll say it later too. Like people are doing, we had this workshop this summer that was incredibly inspiring with faculty from around the country doing lots of really cool things. So this is just one set of resources, and it's certainly not exhaustive. So if you're doing some cool things at the end of this webinar, maybe you can share that with us. We have a process for you to upload that to the faculty corner. We're all about sharing things and not reinventing the wheel. So we can come back and talk about that later. So overview, of loss, grief, and bereavement is the first component. And then we have come up with these are all hyperlinked. So if you click on any one of these, it'll drop you down later in this very long document because it has all of the details of each of these activities. So strategies for exploring grief, loss, and bereavement, there are many of those. The nurse's role in grief, loss, and bereavement, there are several case studies, and we're going to kind of take a look at that in a second. So let's just say that we want to look at sudden death. We're going to look at that case study, okay? So I'm going to double click on that or just single click on that, and it's going to take me down to that case study. Can you see this okay, everybody? Pretty well?
I wonder if you want to make it full screen now that we're done sort of aligning it with the module.
Oh, okay. In just a second. I will.
Okay.
So there's a case study, and then there are these prompts, question prompts. So as I was reviewing these in anticipation of today, you know, several of the, you know, one of the questions is, how is grief from this sudden death likely to be different than somebody that has a chronic serious illness? So you go back in and look at the types of grief. So here in the module are the types of grief. And you can tie this conversation as you unpack the case study back to this section, for example, of the module. Now, this may feel like a lot of detail, but we really feel very strongly that it's so important with these concepts that we take the time to unpack them with the students in the classroom. That it's one thing to just have them do this, turn in, there's a certificate of completion at the end. I'm not sure we mentioned that, but as the student makes their way through the module, at the very end, there's a set of questions that they answer, and they get a certificate of having completed that if they get 8 out of 10 of those correct. And oftentimes, my school included, that's what gets turned in, is that certificate. But what about all this juicy stuff? What about helping the students work through that? So hence the faculty guides. You want to say anything in there, Megan?
One thing I just want to call y'all's attention to the chat. We have all these guides in a Google folder that you can download all of them. So Ryan just put in the link in the chat, the link to the Drive folder where you can access all of these faculty guides. They are in the folder as individual guides for each module or as one big combined document if you want it all in one place. Some people like to organize their files differently, so we have both versions, but that link has just been made available to you so that if you want to, for now, focus with Andrea, but then afterwards, if you want to have access. But we'll also send that link out later today after the webinar. When we send the slides, we'll make sure to include the link as well.
Thank you. Thanks for watching the chat. I can't see it at all. Okay, so now we'll come back over and I will make this a little bit bigger, but I am going to come back to the guide again. I mean, the actual module, sorry. So this is a sudden death, which is a type of death that, you know, maybe we don't think about as much. A lot of this is around palliative, serious illness, palliative care, end of life, serious illness, but there are examples of sudden death, which gives an opportunity to look at sort of what is grief in that scenario that's different than somebody that has been living with family who have a disease that's slowly progressing. So that would be a conversation about, like, let's talk then about different types of grief. What strategies would be helpful for the nurse to communicate with the family at these different times? So this person has come in, this is a seventh grade teacher, and came in through the emergency room, had poor chance for survival, and there's lots of details here. And then the patient then dies. So what would be strategies that would be helpful for the nurse to communicate with the family at these different times? When the family arrives, when the patient is in surgery, and at the time of Heather's death. So what kind of grief might Heather's partner experience, how that might be different from other people, and then more about sort of the impact on the larger community for that particular patient. So as I was looking through that, sorry, I was scrolling to another one. I didn't mean to do that. So let's go back over when it sort of calls us to think about interventions. So you could go over here and move into grief interventions, and pull that back. And you can pull this up in the classroom, right? And look at it again. They will have all done it already. But then this particular section looks at different interventions, and you have a conversation about those at the facility. So the emergency room nurse, beyond healthcare and future support. So this is another place to tie that in. So one of the things, again, that comes up for me is there's the idea of listening. Like, this is an incredibly important time in these folks' experience for listening and being present, right? And so I happen to know this because we put these together. It's not in this module, but it's in the communication module. So there's an exercise in the communication module that I use regularly. I actually used it in a social justice class just this week, not with this kind of topic, but as an opportunity to help us practice being present and listening. And in this case, you could invite the students to pair up, and it's described here in the communication module, into groups of two. And one of the partners is instructed to be the speaker and to describe a loss that they have experienced in their life, for example. And it might be an animal, loss of a home, or some kind of, it doesn't have to be an individual, but something that they would be comfortable sharing that would be a loss in their own life. And they are invited to talk about that for 3 to 5 minutes. I do 3 minutes, and the students think that's incredibly long. And for the listener. And so the listener is instructed to not speak and to just use nonverbal cues that they're present and listening. And it's a great opportunity to practice. We have to practice that. And this scenario, this case study, is a great place for students to practice as a nursing intervention the power and importance of active listening. And then this has debriefing exercises. So what did it feel like to the person sharing their story? Did you feel listened to? Did you feel heard? How was it for you as the listener to not speak? And so that's its own rich experience for the students. So there's one more part of one of the questions in the scenario is, what would you do? What would you possibly say at the time of the person's death? And there is a framework in the module called the CARE framework that is about condolence. And so maybe you pull back to that. So this one case study can take us into several parts of this module to scaffold what they've already done as their preparatory work, and also pulled in some communication components. So I won't take you through it just in the interest of time, but it goes through and gives them very specific, tangible framework for how you might communicate compassionately at the time of a loss. And it's with this acronym of CARE. So I think that that's I want to do one more part I think we have time. Yeah. So the other part of this module that is really important is the effects on the nurse. So this whole section goes into normalizes that we experience loss too as nurses, and the impact that professionals go through. And so there's this whole section in here about the impact on the professionals, seeking help, strategies to prevent compassion fatigue and burnout, a conversation I'm sure we're all having with our students fairly regularly. Um, Moral resilience, wellness and self-care, and so forth. So you can then go to the module and look at all the different, I'm going to scroll back up to the top, all the different things that you might do, the effects on the nurse. So now I'm in that section, right? And there's a list, the title of these different activities: self-care teaching strategies, reflective exercises, the personal loss history. This is very powerful. I'll show it to you. And this is something that we actually did at our workshop for faculty this summer, and it was really moving to have the participants reflect on their own losses and how that shows up in maybe the way we engage or don't engage in teaching this material based on our own losses. Yeah. So here it is. I clicked on it and it took me down to the reflection exercise. And you can take, because, it's important for us to recognize that our own past experiences impact how we provide care, how we are with others, and probably also how we teach. So this is a wonderful exercise that you can use. And they just take a few minutes and answer these questions. And there's a lot of different ways to unpack it. It can bring up emotion and feelings as memories come back, and you can have them partner with somebody and have quiet, small conversations about these different answers. The first death I can remember was, and whole conversations around the answers to each of these can come up. The most recent loss was, and I coped with this loss this way. The most difficult death for me was the death of, and students may not have the context for all of these questions, but they certainly will have some experience related to several of these questions. And this one is brought up a lot of interesting dialogue. I know my own grief is resolved when. And so there's an entry point into this nice conversation about, some faculty said we should take that question out of this because you're never over it. But others felt like this is a good chance to have exactly that conversation around how grief changes over time and is expressed differently. So I think with that, I'll stop and you can take it over. Or we can have some dialogue around this if anybody would like to before we go and look at symptoms.
Yeah, I think if anybody has any thoughts coming up about specifically how might these activities she's explored related to loss, grief, bereavement, I think we could hold space for that. And then, because we're going to kind of pivot to a different type of idea. So I think hold space if there's thoughts or questions.
I do want to recognize Pamela's comment about the pause. The pause is wonderful, and it is actually integrated into the core curriculum. I can't remember if we have it we do have it. I can't remember which.
It's in final hours, I believe.
Final hours. Okay.
In our 6th module, it's in there, but we do have that video. Mm-hmm.
Thank you for that, Pamela. Is the movie freely available? The pause. I don't know, but we have it in the guide. I'd have to. It probably is if you just Google the pause, and it actually was created by a nurse up in Washington somewhere. I think an emergency room nurse, ICU nurse.
If it's not on YouTube, which I think it is, if it's not, it is in our module. And again, faculty get free access to. You could have that queued up. Your access to it. You could pull it up and show it in class that way.
Christy confirmed.
Yeah, pretty sure it's on YouTube. It's a pretty.
It is.
Oh, look, the link. There it is.
Thank you. Nice. Nice teamwork, everyone.
All right. Well, maybe if you just want to kind of keep an eye on the chat and if things come up,
sure.
We can do that. Okay. So for a little bit of something different, but the same, I'm going to take us through sort of some similar thinking, but with a different module. So hopefully y'all can see, I've also done the two screen. Are
Yep.
y'all seeing that okay?
Yep.
So we have guides again for each one of our modules. So for example, today I brought up symptom management. The module goes through kind of an introduction of symptom management for different age groups, some important assessment things. This reviews those lovely mnemonics we like to teach students with assessment with pain, but we also encourage them to use those same, that PQRSTU, or we give them different options, those mnemonics to help with assessing symptoms as well. And then we have a section on physical symptoms and psychological or social symptoms, psychosocial symptoms, sorry. For each one, we kind of give some information about the disorder, important assessment information, subjective and objective. We do break all the assessments for each one into objective, subjective. And then there's sections on management of dyspnea, or whichever symptom it is that you're really focused on. Mm-hmm. Again, this is a great way to introduce students to this. But what we need to do as faculty is then help them think about, well, how do I apply this? I might know this, but then what do I do when I'm caring for a patient who perhaps is experiencing dyspnea? And so that's where we have some resources again in our guide that we can refer to. So I'm moving, I don't know if y'all see the things overhead, but I'm moving them out of the way so I can see better.
Yes.
So very same layout as all of them. They all start that same way. They're all aligned with the main sections. One activity I want to share first is this dyspnea empathy exercise. I find this is really powerful with our undergrads because they might know what dyspnea is. They could give you a definition, shortness of breath, right? They can articulate it, but do they really know what it feels like? So I actually taught symptom management this week with my students, and I took them through this exercise. And you just sort of see these light bulb moments of, wow, that's what it feels like to have dyspnea associated with maybe some chronic conditions. Very, very quick exercise. Again, so this is a nice way to help them sort of take a moment to put themselves in the patient's shoes. What does it feel like to experience the symptom before they start unpacking it as well? We do have case studies here as well. We do try to name them with either the type of condition or which specific symptoms that they explore. One thing to note about case studies is some of them will have just the questions. Others of them will be like here, where you see in italics answers. All of these case studies, Andrew and I pulled from our existing LNET curricular resources. Some have answers, some do not. But again, we wanted to just utilize what was there. And so just wanted to clarify why some answers would be there and some would not. Of course, if you're not sure what the answer is, you can always go to the modules for resources. You can always reach out to us if you're wanting some clarity on that. But there's case studies. We do try to, in all of the faculty guides, we do want to consider across the lifespan. So as much as we could, we try to include things for pediatrics, include things for geriatrics. There's some case studies that are in the maternal newborn space. So we do try to have different settings, different populations represented in the resources that we provide. And then I wanted to just share two types of activities that we've integrated into a few of the guides just with different resources. One is ethics and position statements. And so this comes up in pain, this comes up in several of the modules, but we went and looked at different professional organizations and pulled their position statements that might apply to the module content. So for example, for symptom management, position statements about pain and symptom management, or palliative sedation, or artificial hydration and nutrition, which we talk about in the module. But these statements align with what we've talked about, the content of the module. And so this is opportunities for faculty to get students into ethics statements and what do professional organizations say is the nurse's role How might those position statements be similar or different, or how might those align with their personal values and beliefs, or where might there be some discordant feelings, especially, for example, you might pull up the one, the therapeutic use of marijuana and cannabinoids, and maybe they have to kind of do some personal reflection on that. So we have these. It's not saying there's a one right or wrong way to use it. We just wanted faculty to know, here's position statements we've found that are related to symptom management, and you can envision what that might look like. This could be great opportunities for ethics courses too, as well. And then this is one of my absolute favorite activities. I did it with my students yesterday, where students are really creative. They're very digitally savvy. I have my students create infographics for our different symptoms, and LNEC has created several, so we do provide the links so you can have access to those. I share those. I post those in my course management system for the students, so they have access to those as well. But to just have them think about using some sort of platform, Canva, Google Slides, whatever it might be. And they work together in groups. My students, they work together in groups, and I have them talk about, I'll assign them a symptom, and they have to talk about assessment and non-pharmacologic and pharmacologic management and any other important things they might want to consider. And to do that, they go back into their module and they go to that section for their specific symptom to find that information, to pull it together. And then I have them share it with the class. And I love it. It's a lot of fun. They get very creative with memes and pictures and other things as well. But this is an activity we've included in the symptom management faculty guide as well as the pain guide, because that's where we kind of follow nursing process a bit more, but you could do with anything. So again, it's just some of this, what's in the guides is things that Andrew and I use in our teaching, or we've had colleagues who've shared that with us. Some of these come straight from LNEC resources. Some of that is things that we've just come up with that we want to even try ourselves, but we think, that seem to be based on some things we've learned about in other spaces we've applied to palliative care. I think, one of the things to bear in mind with this is there's no right or wrong way to use these. We just want to have a compendium of resources where faculty can envision what's right for your students based on their level of progression in the program. I'm going to use this strategy different for a student who's in their first semester of nursing coursework versus students who might be near graduation. So how, you might use them differently. You might use them for different courses or different contexts or different populations, but it's just to give some ideas. And then the last thing I wanted to mention, sorry for the very quick scrolling, symptom management, we have just some critical thinking questions, just some things you might want to throw out there in your class as part of a class discussion. Many of our guides also will have towards the beginning something that looks similar to this, but little boxes that have just shorter prompts or really quick activities that you might do. So some are the full case studies or full activities. Others are just things like this, like here's a question, or maybe you might want to have them consider doing this sort of observational experience, just things that we wanted to share to help offer some ideas that you might want to integrate into your classroom or into your clinical spaces as well.
Yeah, thank you for saying that, Megan. I know of one person on here who is focused clinically. So from my school, hi, Nikki. And so, again, we try to keep people remembering that these are resources that can be used in so many different settings. I went and looked at grief, loss, and bereavement real quick as you were mentioning those different prompts, and that one starts out that way. So when words that are not helpful, words that are helpful, and just having conversations around some of those other things as just general class discussion topics. So we have like 20 minutes. And one of the things I wanted to just add, and then we'd love to hear from you a little bit. We have a lot of folks, which is just shocking for the second week. Well, for me, it's the second ending of the second week of the semester on a Friday at the end of the day for many of you. So thank you so much that you're here. you mentioned all those position statements. So I teach a social justice and population health course right now at the same time that our students are taking a class chronic illness where 3 of the 6 modules are embedded in that course. So in the social justice course, nursing ethics is one of the concepts. And so we will be trying to weave those 2 courses together by going and looking at some of those position statements as the students are simultaneously looking at those particular modules in the chronic illness course, just as an example. So love to hear from any of you, things you're doing, questions you have.
I'm going to snag the screen share again because I did also want to mention just a few more things.
Oh,
Real quick. Sorry. Can you see the guide again? Hopefully.
yes.
One thing that we want to also let y'all know is that where possible, we wanted to share more resources. So like the pain and the symptom guides have all of these different assessment tools that come from the Palliative Care Research Cooperative. So lots of tools if you want them to explore different ways they might assess these symptoms in different populations or for different diseases. Again, that's just do with that what you will. But also where we could, we've tried to identify, and it's not in symptoms, but it's in other ones. We also tried to share any podcasts or videos that we found.
Yeah.
There's Defining Hope is a great video series that has some case studies. So again, it's not just written things. We also try to connect you to existing technology like the Pause YouTube video, but other videos or podcasts or things that you might want to have students do outside of class, watch outside of class, or use in your classroom as well. So it's really trying to, as much as we could find and compile together, we wanted to have it in one place for faculty to use. Also, one thing I forgot to share.
Thank you for that. Are ideas churning?
I think there's some co-faculty on the chat who are sharing ideas, which is so exciting to see.
Mm-hmm. Anybody want to offer a thought or an idea or reaction? Brianna. Yes, Jessica. Yes, you want to offer?
I can offer.
Thank you.
I was saying yes to ideas are churning. So my ideas that I might, and I'm outside. If you hear dogs, I apologize. I was introduced to the curriculum through other faculty. I'm an early career faculty member, and I just took over the OB lead at my school and doing some research on perinatal bereavement. And so currently, the course I inherited has, we have so much content to fit in so many weeks. It has a very small piece surrounding fetal loss, stillbirth, whatnot. And I earlier this week, I briefly went through the content that that has been provided, and it's so rich and there's so much, and I'm just in my mind trying to figure out what pieces. I don't currently, I can't envision incorporating the totality of the resources in my course, and I'm trying to wrap my head around what might be the most important as I build that out for future courses. Like, what could I put in place in 12 weeks from now at the end of the semester where that content fits? And so I'm excited about it. I'm currently doing research with a colleague from parent perspective on perinatal loss and bereavement. So it's really important to me. But I'm just right now, my brain is going 100 miles a minute trying to figure out how to incorporate it.
Oh gosh, that's exciting. Yeah, I think that first of all, I think you have permission to not even come close to integrating all of this.
Right.
It's
Sure.
just so many choices, right? And I appreciate you mentioning there's so much that you have to teach that's already there. So rather than trying to fit something new in, maybe one idea is to, within the context of what you already are teaching, can you imagine using some of these things as teaching strategies in existing curricula?
And the other thing to consider, and this is something we talk about in our faculty, is that, and we talk about with other schools too, is that palliative care is not a one lecture thing, right? It's not just 1 3 hour lecture, check box, we did this. That really students need to be able to scaffold this across their curriculum. And
Absolutely.
so, we might introduce the idea of pain in the assessment class that they take, but they're just trying to understand what am I assessing? And often we start with just explaining, contextualizing pain as pain is their only the only thing they're experiencing at that moment. Well, as students progress, they need to start thinking about how do you assess pain when there's other symptoms present, or how do you assess, how do you manage pain for a patient who has multiple sources of pain? And so we have to help them kind of think about how we scaffold. And that really takes the faculty coming together collectively to talk about where are these principles coming into play? Where are we touching on teaching some of this? And then how are we reinforcing this as they progress? Students, when they purchase the modules, have access for 12 months. So for me, I try to make sure they've at least worked through the modules the first time, and got through them across 12 months within our curriculum. And sometimes we start some modules at the end of a semester and then early, later on in a future semester. But then you as faculty would still have access to those. So that's where you can, again, bring those back up for the students in class, even if their access might have expired. But that it can't be just a one-time thing. And then the other thing is, I think I mentioned that we posted our perinatal palliative care module. That, not that you need any more things to process and percolate, but that's been posted to the corner for free access too, and that might give you more ideas. But it really does take a group effort on this, and so the thing is too, any faculty can get access to LNEC undergraduate, and what we'll be doing is when faculty request access, when we send them information on how to access it, we're also going to send them the link to these guides. So faculty colleagues can get access to these resources as well, and think about how they might use those in their classes. And it doesn't even have to be a palliative care focused lecture, right? We teach chronic illnesses in lots of ways. We teach serious illness in lots of ways, and that might come up in unique opportunities for them to think about how might they enhance their courses as well.
So I'm wondering if there are folks here, just because I'm having a conversation with somebody from my school who teaches clinical, as a way of remembering that people with serious illness are everywhere. And it is an unfolding kind of conversation and interaction we have with students, and maybe, I mean, with patients, and maybe it's the communication module. Maybe those of you that are in clinical open up that module and look at some different things that you could use in post-conference around enhancing communication at the bedside, or the symptom guides. And I wonder if anybody here has any thoughts about how you could use some of this in clinical.
Good afternoon. Can you hear me?
Yes.
Okay. I'm in the car driving, so that's how I was able to attend. So thank you for your presentation. My name is Sophia Robinson Harris. I'm an associate, I want to be an associate. I'm assistant professor at University of West Georgia, Carrollton. My DNP project was actually about the incorporation of the pause in sudden death in an emergency room. So I think it's really important, and I mean, I guess anybody on this call would agree that we kind of start talking about this at that education level, because it is affecting clinical nurses practicing now. I'm very interested in getting those modules, so thank you. I have not yet reviewed them or the faculty corner to see what resources are available. We don't have a dedicated presentation on palliative care or end-of-life care at our school. It's kind of woven in, is what I was told, to other areas of the curriculum. So I would like to introduce this module or this resource specifically because it's already kind of, I know it's evidence-based and it's already done. So there's, we just have to kind of familiarize and then present it to students, right? And have them go work through the modules. So how would I position myself and what would the best way for me, like, because I already know if I'm going to present it as opportunity, they're going to expect me to be kind of the LNEC person for the department. Mm-hmm. How would I go about that, or what would you recommend as part of my proposal for this?
We have a resource for you.
I was supposed to say, that's great. So two things. I'm going to hop to the corner. I'm going to share screen and hop to the corner because I'm hoping this might give you a starting point. We can't, every school's different, but when you go to the faculty corner and you scroll down, so we have a section on the online curriculum. This is where you can find information about those curricula. And once you go in here, this is where it's got the module objectives, our competence statements. We want to make sure people know about CARES and GCARES. But here under student and faculty access, there's this sample proposal. And this comes from our colleagues at Creighton University, who, again, all of this is free to download. It's made available to faculty to use how they want. I actually use this at my school, but they shared their proposal for what they took to their curriculum committee. And as a way to say, here's how I want to integrate it in the curriculum. When I was doing it, this was a great way for me to be like, who do I need to talk to? Which courses might be teaching pain already? And how might I talk with them about, can this be used as their prep work or what needs to happen? But this proposal's on the faculty corner. It even has background rationale, all those things we like when we do curricular meeting things. Mm-hmm. So that's there. And then
the other thing to remember is many of us have been there. We've been exactly where you're at. And this is a great resource to help provide the rationale. And for me in particular, that journey was happening before the essentials came out. And so now you even have more incentive, if you will, for schools to support that. And then if you really want to keep rolling with that, you can go to one of the LNEC courses and take the training yourself. There's a couple, is it on here, Megan? I think it's on another page.
Yeah, LNEC Summits. You can get
to next April is the 25th anniversary and it's in Hawaii. So maybe you become, be careful what you ask for. They may indeed have you be the champion, but that wouldn't be such a bad way to start. There's also one in New York coming up.
The other thing I want to mention
here for more conversations if you want to reach out to us again later.
We also have a regional model where we've identified some faculty who can support schools within certain states. So that's on the website. You can just find your state. And
where are you again?
I'm in Georgia.
Oh, we might have
Georgia. You're going to talk with Andrew and I. We're looking for a Georgia champion. So.
Yeah.
but that's here as well. So the other thing too is for any faculty who are starting on this journey, or maybe you feel like you're the one person trying to championing this through your curriculum, that's part of where these resources came from. Is it's already a lot of work to be the one person trying to advocate for this. So we thought, let's just make it a little easier by saying, here's some ideas. But also like there's a community of people willing to support you outside your school. And that's either Andrew and I or some of these regional chairs. We like to say we're an LNEC family. We like to support you. So anytime you're having a sticking point or needing someone to talk to, come reach out to us.
Yeah.
We're happy to help in that way too.
Thank you. That's awesome. Thank you so much.
Any other comments or thoughts? I know it's late for many people. We don't have to stay on until top of the hour.
I do want to while those ideas are coming, just let people know that we do have our October webinar already scheduled. And it is going to be October 23rd. I guess I can share my screen again. Sorry if there's whiplash from all this sharing, unsharing. Um, so on our upcoming events part of the Faculty Corner, we will have October 23rd. We're going to be joined by Dr. Carrie Cormack and Dr. Kathleen Lindell from MUSC, the Medical University of South Carolina. They're going to talk about how they've integrated LNAC into their graduate curricula. So a really great exemplar of how you might utilize LNAC resources to advance your graduate education.
Or please pass that on to others in your program if you don't in the graduate program.
And then November, we're going to be really excited. We've got some colleagues who came to our summer workshop and shared their posters, and we're going to hear more from people doing really exciting things at different schools. So be on the lookout for that. It should be early November-ish. We're still trying to finalize that date, but wanted to let people know that that's the next webinar.
Florence, maybe we should talk. Have a conversation. It's challenging to incorporate in pre-licensure two-year programs. There are many that are doing it, but it would be I'd be happy to have a conversation, either one of us. Where are you?
New York State.
Okay.
Yes. Thank you. I'll reach out to you.
Okay. And you have our email, so we'd be happy to talk to you.
Yes. Thank you.
And that's the other thing, we're here as resources, the website, the corners, there's resources. These faculty guides are hot off the press. Now we're not putting the faculty guides we just shared you on the corner. We want to make sure that people who are using those, that it's sort of tied to the modules, because that's how we've envisioned it, is we've aligned it with the content of the modules. So
as you can see today,
exactly. But there's all sorts of other great things on the corner, and things are being added constantly. So it's sort of a living, breathing website with new resources being added. But we will make sure you, again, get the slides from today and the link to that folder later today, or maybe first thing tomorrow. We are kind of getting later in the day. So
Monday.
Not tomorrow, Monday. Yes.
Exactly. So wishing you all well as you start the semester, and look forward to having you join us again next month, or the next month.
Thanks, everyone.
Have a good weekend.